You and other top officials wanted to recommend social and physical distancing guidelines to President Trump as far back as the third week of February. But the administration didn't announce such guidelines to the American public until March 16th, almost a month later. Why?
In China, millions are quarantined. Is that where we're headed here in the United States?
I don't imagine that the degree of the draconian nature of what the Chinese did would ever be either feasible, applicable, doable, or whatever you want to call it in the United States. I don't think you could do that. As I've said many times, we look at it from a pure health standpoint. We make a recommendation. Often the recommendation is taken. Sometimes it's not.
Do you think lives could have been saved if social distancing, physical distancing, stay-at-home measures had started third week of February instead of mid-March?
The idea of social distancing,
yeah.
I mean, obviously that's something that will be seriously considered depending upon where we are in a particular region of the country. You're right. I mean, obviously, if we had right from the very beginning shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
You said there was pushback.
Yeah.
Where did that pushback come from?
No, it wasn't. And that was the wrong choice of words. You know what it was? When people discuss, not necessarily in front of the president, when people discuss, they say, well, you know, this is going to have maybe a harmful effect on this or on that. So it was a poor choice of words. There wasn't anybody saying, no, you shouldn't do that. But I don't regret saying that the only way we could have really stopped the explosion of infection was by essentially, I want to say shutting down. You wear a mask, they wear a mask, you protect each other. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. So I want to make it be a symbol for people to see that that's the kind of thing you should be doing. Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. I mean, I do it when I'm in the public for the reasons that, A, I want to protect myself and protect others. I had my mask around my chin. I had taken it down. I was totally dehydrated, and I was drinking water, trying to rehydrate myself. And by the way, I was negative COVID literally the day before. So I guess people want to make a big of that. I wear a mask all the time when I'm outside. There are unintended consequences. People keep fiddling with the mask and they keep touching their face. I feel that universal wearing of mask is one of 5 or 6 things that are very important in preventing the upsurge of infection and in turning around the infections that we are seeing surging. No, there were times when I was out there telling the American public how difficult this is, how we're having a really serious problem. You know, and the president was saying it's something that's going to disappear, which obviously is not the case.
I don't think people should be frightened. I mean, the risk right now, today, currently, is really relatively low for the American public, but that could change.
Again, we're trying to get the right thing done by getting the right word out.
So right now, don't worry about it. Be more concerned about influenza.
Yes, when you downplay something that is really a threat, that's not a good thing. Given the percentage of people, which is about 45% of the totality of infected people, likely are without symptoms. And we know from epidemiological studies that they can transmit to someone who is uninfected, even when they're without symptoms. In all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. So to make a statement to say that's a rare event was not correct. And that's the reason why the WHO walked that back. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
Remdesivir had little or no effect on mortality for those hospitalized with COVID-19.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important.
The drug also does not seem to help patients recover any faster. The findings were part of a trial by the WHO using 4 drugs, which included hydroxychloroquine, interferon as well, and it covered more than 11,000 virus patients in 30 countries, but it has not been peer-reviewed or published in a scientific journal.